Thank you very much for having me here. I'm very happy to be here. I'm now living in Mesa, Arizona, near Phoenix, so it was a long trip, but I got to visit with a very good friend of mine, Leslie Appel, and I'm happy to be here and share some information with you. We're going to talk about basic dental requirements because I know that it's very difficult in shelters to provide the A-plus care that you might see when you go to a veterinary specialist because you have to do so many things on a very fixed budget. But because dental problems are very common in all animals, probably 70% of all animals over 3 years old have some kind of dental problem, it's important for you to be aware of them and to how to be able to treat them in the most efficient manner so that when they're adopted out, they have a healthy mouth. So the first most important thing is a good oral exam. And so we should be doing oral exams on all these incoming patients to make sure that there isn't a major problem with that patient so that it can be addressed in some way. And we'll talk about how that can be addressed in different ways. So the basic instrumentation that you all should be having in your shelter is a periodontal probe. It has an explorer on the other end, and then certain types of elevators and extraction forceps in case a dental extraction needs to be done or sent to a neighboring shelter or a veterinarian, so that can be done. Other things that are very nice to have would be an ultrasonic scaler, polisher, or they also have hand scalers if that's not available. You can have a high or a low speed dental unit. The low speeds is what I started out with quite a few years ago. Inexpensive, you plug it in and you're in business. And then the bottom thing, the dental x-ray unit. And I know that that may be beyond the means of quite a few shelters, but if you could have one shelter in a larger area that has a portable x-ray unit, that could serve a lot of different shelters. Or partner with a veterinary school or even a local veterinary practice when that becomes necessary. So the most common disease that we see in dogs and cats today is periodontal disease, more common than skin problems, which is hard to believe. And my dermatologist at the University of Illinois would swear that dermatology problems were more common because you could see that. But if you lift the lip up and you look inside an animal's mouth, you'll see there's all kinds of dental problems. And if we don't recognize it and treat it, the disease is going to get worse. So here we have, quickly, I'm going to go over the anatomy. This is the gingival sulcus. In health in dogs, that should only be 3 millimeters deep and 0.5 millimeter in cats. But as periodontal disease progresses, this gets deeper and deeper, and we start to lose attachment of the tooth to the bone. So there's certain things that we know about periodontal disease, and again, remember, this is the most common disease that we see in pets today. And what happens is that as the animals get older, periodontal disease gets worse. As the animals are smaller, it's going to develop more quickly in the small animals. So how many of you see a lot of small animals in your shelters? How many see large animals? Okay, so a lot of you are seeing the small animals. You're going to see a lot of periodontal disease, especially once they get to be over 3 years of age. And the cause of that is the plaque and the calculus on the teeth that causes inflammation, and then we have bone loss. There's different stages of periodontal disease. It starts out as gingivitis, just inflammation. If we treat it then, it's resolved until the next time the plaque and the calculus build up, and then it comes back and you clean it off and it resolves. But if it's not treated, it progresses and we start to lose attachment loss between the bone and the tooth. And when we lose 25% of all the attachment around that tooth, that's stage 2. Stage 3 is where we lose 25 to 50% of all the attachment. And then stage 4 is where we lose greater than 50% of our attachment. And at that point, the tooth starts to become mobile and we lose the tooth. So this is what stage 1 would look like. I'm sure you're seeing that every day in your shelters. And it would be nice if, before these animals are adopted, if those teeth could be cleaned. Now, again, that's probably not a priority to get the teeth cleaned at this point, but it would be very quick and easy to do. And then the dog or cat has a healthy mouth when they go out for adoption. Stage 2 is where we start to lose a little bit more bone. Here we see a little bit of bone loss, but less than 25% of all the attachment around that tooth. And then stage 3 is where we lose between 25 and 50% of our attachment. And then this is what happens when we don't treat, and then you might have an incoming older pet coming into your shelter and you see a mouth like this. Have you been presented with dogs that look like this? Yes. And with this, I think it would be hard to, in good conscience, trying to adopt out an animal that needs that much work. And what we would do at the University of Illinois is we would volunteer our time, go down to the shelter, do some dental work with the shelter so that these dogs would be more adoptable. So if you can partner with a local veterinarian, or better yet, have somebody on staff trained to take care of situations like this, and we'll talk about opportunities and how that might occur. But my anesthesiologist used to call this picking blueberries. You know, it was so easy to remove those teeth that they almost fell out on their own. And this is what full mouth x-rays on that dog would look like. And you could see the bone is so severely lost that the teeth are kind of floating in space. And then they end up with potential jaw fractures because they've lost so much bone. So it's nice to get a hold of this disease early on. So the big thing that we want to do, again, is you're mostly often anesthetizing these animals to spay and neuter, so that's a perfect time to get a good look in the mouth, see what's going on. Is there a lot of calculus in there? Is there are there fractured teeth, resorptions in cats? But the simple thing that you can do is to check for periodontal disease, is to look to see if any teeth are mobile. If the tooth's really wobbling in there and you do your periodontal probing, there's a big pocket, it's an easy thing to just go ahead and remove that tooth. The dog is better off without a tooth like that rather than having it in pain. Dental x-rays may be beyond the capabilities because you just don't have it in the shelter setting, but you can get a used dental x-ray unit from a human dentist for perhaps several $100s. And so there's ways of getting around and being able to have that capability, or have a centralized one unit to share amongst numerous shelters when the need arises that you can't make your diagnosis just based on your oral exam. So there's grades of mobility. Grade 1 is very slight, where the tooth only moves slightly. Grade 2 is where it moves at least 1 millimeter, and then grade 3 is then it's more than 1 millimeter. And once it gets to grade 3, that's an indication for extraction. So here we are now using our periodontal probe to look for deep pockets. And again, like I said before, 3 millimeter pocket depth is normal in dogs, but in cats, 0.5 millimeter is about normal. So you want to go in there, stick the periodontal probe in there, look for a deep pocket, and then say, for example, a 3 millimeter pocket may mean a lot of different things in different animals. And what we're showing here is, if you can imagine, the red line on each of the teeth there demonstrates where the gingiva would be in any particular case. So in case A, the gingiva has kind of become hyperplastic and grown up the tooth, and you put your periodontal probe in at the gingival margin here, and you end up with a 3 millimeter pocket down to the bottom, and that's really only 3 millimeters of attachment loss, because this other 3 millimeters is the gingiva growing up the tooth. So that's kind of a good situation. You could just cut off that excess gingiva, and the dog only has a 3 mm pocket remaining, which is not too bad. Well, over here, where we have our gingiva at the cemento-enamel junction between the enamel and the dentin, and you have a 6 mm pocket, that is true 6 mm of attachment loss, and that's a little more significant. And then the worst case scenario is if you happen to have gingival recession down the root, and here's your gingival margin, and you have a 6 mm pocket, that means you actually have 9 mm of attachment loss, and that is a more serious situation, and the tooth probably needs to be extracted. So there's two kinds of bone loss that we see in our patients. We see vertical bone loss, that's bone loss up the root of the tooth, and that's fairly common where we see deep pockets, but we also see a horizontal bone loss, and that's where we lose a bone along and parallel to the cemento-enamel junction or the alveolar margin. So here's two examples of what vertical bone loss and horizontal bone loss would look like. Here we see vertical bone loss, and when we have vertical bone loss, I recall when I was first learning about dentistry, if we went in and the tooth was loose, you know, wobbling quite a bit, we would take it out. If it wasn't loose, well, then that's still good. Well, that's not necessarily the case, because what happens when you have vertical bone loss like this, you lose bone all the way down to the apex of the tooth, and then the bacteria get into the tooth, inside, go all the way around the pulp, come out the other side, and you end up with an infection on the other root. So that tooth is dead, and it should be extracted. And without an x-ray, you would maybe not know that, but if you saw it, because the tooth wasn't loose, and you would think, oh, we can save that, but the x-ray helps determine that. And here we have, on this case, an example of horizontal bone loss, where it's parallel to the edge of the bone, and we've lost at least 50% of our attachment, so that tooth would be mobile, and that should be extracted. So the other thing that we see a lot in our patients is furcation exposure. The furcation is the lesion between where the roots divide. And some clients would come in and say, oh, my dog has a cavity, but in reality, all it has is gingival recession and exposure of that furcation. Just because you have furcation exposure doesn't mean that the tooth needs to be extracted, but it should be cleaned. And class 1 is where you can barely get the probe into the furcation. Class 2 is where it gets in there, maybe halfway across or 3/4 of the way across, but not all the way through. And then class 3 is where it goes all the way through to the other side. And if the dog, like this case, has severe inflammation around that furcation exposure, it's not likely that the dog's going to let the new owner brush. It might be a good idea just to extract that tooth. Okay, so what are the common clinical signs of periodontal disease? Well, we talked already about mobile teeth, gingival recession. They might be bleeding. They might have abscesses, swollen faces. And the big thing that I'll bet you see quite a bit, especially if you're seeing a little older population of small breed dogs, is they may come in with nasal discharge. And so they're sneezing, they may have mucopurulent nasal discharge, it may be bloody nasal discharge. And that's where our good oral exam comes in. And so here we see a dog with mobile teeth, and they're a good indication for extraction. We will take our periodontal probe, look for deep pockets, and once you see a deep pocket relative to the length of the tooth and the tooth mobile, that would mean that it is a good indication for extraction. And so you could see how deep that pocket is on that canine tooth. And if you look at the tooth, it looks pretty darn good, but you realize you have a deep pocket, and then sometimes you might have some mandibular swelling in that patient. Sometimes you might be presented like this. If you see a lot of greyhounds or even beagles, they're prone to getting a lot of horizontal bone loss, and this this dog would benefit obviously from multiple extractions. Sometimes you'll see these cats come in with severe inflammation, gingival hyperplasia, or severe inflammation even in the back of the mouth. This is what we refer to as stomatitis, and that's a whole nother thing for another lecture, but basically they respond very well to extractions as well in most cases. But see, here we have a dog that's presented for facial swelling. You lift up the lip and you do your periodontal probing and you fall into a deep pocket and purulent material comes out through that pocket. And it's a simple fix by extracting that tooth. In cats, what we see is sometimes dental disease can cause mandibular swelling. And that's part of your exam when you're looking at these, assessing these patients when they come in. Look in the mouth, but also palpate their mandibles, one side compared to the other. And if you do that on every single cat that you admit into your shelter, I'll bet probably out of maybe 20, 30 cats, you'll find one that has swelling of the mandible. Could be related to a tooth problem, or it could be related to cancer. So it's always an extra little part of your physical that can help tip off that there may be something going on. And so we see here in this case, we see swelling, firm swelling here. And on the x-ray, it looks like, wow, this is what's going on here. But actually, this is just a severe mandibular swelling secondary to periodontal disease and root resorption. Probably you've seen this in your shelter practices where you're presented with a cat and he's got these long fangs and he's got swelling around the root of that canine tooth. This is what we call super eruption of the canine tooth. That's where the poor cat is trying to get rid of this tooth. So it's rejecting it, it's getting longer and longer, but it might take several years before that tooth falls out. In the meantime, it's quite uncomfortable for that patient. But if you see a cat with this swelling around here, then you go in and you look for deep pockets. It could obviously indicate that that tooth should be extracted. And this is what it would look like radiographically. You see expansile bone around a deep pocket of the canine tooth, and the canine tooth is super erupted. Okay, the next thing I want to talk a little bit about are those dogs that come in with nasal discharge. You know, they come in, they're sneezing, they got mucopurulent nasal discharge or bloody nasal discharge. Well, the most common reason for that is that they could have an oral nasal fistula. And the reason that our patients get so many oral nasal fistulas is that there's a very thin shelf of bone. Here, this is a cross section through the dog's skull. And this, on the right-hand side, that's a close-up of the picture on your left. And you can see that there's only a thin shelf of bone that separates the tooth root from the nasal cavity. So you could imagine if you have periodontal disease with attachment loss, you stick your periodontal probe in there. Instead of going into the periodontal ligament space, which is this tiny little space right here, it's going to go into the nose because the bone has been destroyed. And that's why these dogs come in sneezing and sneezing. They could have a nasal foreign body, they could have a nasal tumor, but I would say probably 8 out of 10 times it's going to be a deep periodontal pocket. Take out the tooth, close the defect, and the dog is cured. So simple things like that that can really make a difference in the adaptability of some of these patients. So here we see a dog that came in with mucopurulent nasal discharge, usually on one side. That's the key, although it could be bilateral. And then you take your periodontal probe in there, and you see it all of a sudden buries right into the nose. And then oftentimes, if you have the head in such a way that it's down relative to where you're probing, blood will come out of the nose on that side as you're probing because you're, poking around in the nasal turbinates. The other thing that you'll see in your shelters are dogs with broken teeth. Very common problem in our patients. And for years and years, veterinarians, and even today, they really don't think too much about it, but I'm going to tell you why it's kind of important to recognize it and perhaps be a little proactive in managing them. Because what happens with dental fractures is when a tooth becomes fractured, if enough of the tooth is fractured, the pulp, which is the inner aspect of the tooth, becomes exposed. And when it first becomes exposed, it's very painful. And as it goes on, infection can come out through the tip of the apex and cause abscesses. So this is what acute pulpal exposure will look like. It's bleeding, it's painful. Several weeks later, they get a granuloma over the tip of the pulp. Starts to become a little less painful. Becomes a bacterial pulpitis, still painful. And then the tooth dies and it's dead and there's no pain anymore, which is a good thing. However, what happens is the inflammation from the fracture, and you can't see the fracture because it's on the other side, gets in, it allows bacteria to get inside the tooth. It comes out through the apex and causes an infection in there. And that's why you see these animals come in with the carnasal tooth abscesses or muzzle swelling from fractured canine teeth. The other things that you might see with fractured teeth are these draining tracts. And you see a draining tract here, draining tracts here. And they usually occur in the overlying the apex, or in the upper canines. They come down and they drain out at the area where the mucosa meets the gingiva. And here we are. And if you see, that tooth doesn't look that bad, does it? But it might have some mandibular swelling. You look at a draining tract, and this is where the x-ray becomes important. You take an x-ray, and you could see those periapical lysis from the infection getting into the bone and causing bone loss. And so I'm sure you've seen this whole case scenario where the dog comes in with the facial swelling. All you have to do is lift up the lip, look at the fourth premolar, because that's the one that's most commonly fractured, and see if you see a little dark spot. You'll take your dental explorer, and if it goes in there, you have your diagnosis. Another thing I'm sure you see a lot of is dental wear or abrasion. That's where the dogs may have like flea allergies or something like that, and they're constantly gnawing at their skin, and they wear their teeth down to little nubs. And if they do that slowly, the pulp recedes, reparative dentin's laid down, and no treatment is necessary. So that's a good thing. But if it happens too fast, the pulp doesn't recede fast enough, then the explorer will go into that dark spot, into the tooth, and that's where something needs to be done. Extraction. But very common, and I would say probably 9 times out of 10, dental wear is slow enough that the pulp is not exposed and no treatment is necessary. Here's an example of a very severe case. This dog had severe flea allergies, constantly gnawing at its skin, and he was painful. He'd go to eat and he'd drop his food. And we took some x-rays and we could see that he had a little bit of osteomyelitis going on here, and when we probed all those teeth, there were openings into the pulp, and so we went ahead and extracted those teeth. Okay, now, what about cats? Do they fracture their teeth? Well, the most common tooth that you'll see fractured in a cat is the canine tooth. And the reason for that, fractured where we get pulpal exposed, and the reason for that is if you look at a cat's tooth, you can see that pulp comes almost all the way down to the tip. So all you have to do is lose a small amount of tooth structure in a cat, and you have the pulp exposed, and then you have that whole case scenario that we talked about. So this is what happens when a cat breaks a tooth. And this happens to be a deciduous tooth in a cat on this side, and you can see the draining tract, and you can see, when you see a gray discolored tooth, it's dead. and that means that it's a potential for infection. Here we see another draining tract in this cat with a fractured tooth. And this was a cat that had a draining tract for about several weeks. The veterinarian treated with antibiotics, the draining tract got better, stopped the antibiotics, the draining tract came back. It also had nasal discharge, and when you lifted up the lip, you could see the fractured canine tooth, and so just a matter of taking out that tooth. Here, this happens to be a draining tract on the chin of a tiger cub, deciduous tooth fractured. Draining tract, that's what they'll drain, sometimes either in the mucosa or in the chin. So if you ever see a draining tract like this, or like a big swelling under the chin in an animal, the first thing you want to do is look at the canine teeth and see if there's a fracture there, because 9 times out of 10, that's what it'll be. Okay, so now what if you see like maybe a discolored, gray discolored tooth? How can you diagnose if it's dead or alive? Is that a problem with that tooth? Well, what you can do is what we call transilluminate the tooth. You can take a very bright light. They come with the otoscopes, and there's a bright light, or if you don't have that, you could even use a pen light. But ideally, a very bright light, put it on the inside of the tooth so it's shining towards you through the tooth. And if the tooth is dead, it will appear like this. No light will come through. You see the dead pulp in there. Versus a live tooth, it'll light up like a candle. And if you take an x-ray of that, this is what you might find. You could see this tooth is super erupted. The body's trying to get rid of it. It has periodolysis around the root tip, and the pulp canal is much wider than the other side because it died a while ago. And what happens is the tooth develops, and when it first erupts, the pulp's very wide, but as the tooth matures, it gets more and more narrow to the point where you might not even hardly see the pulp, like you see on this side. And this tells you that dog had that infected tooth in there for years and years and years. And so that's why a good oral exam could point to a problem so that it can be addressed. Okay, now, how many of you see root resorptive lesions in cats in your practices? Okay, this is something very common problem in cats. They say almost up to maybe 60% of all cats have these lesions. And I'm going to go through this pretty quickly because it's a little detailed, but there are resources where you can learn more about these lesions. And they can be quite painful, but they look like gingiva growing over the tooth in certain spots, or they could get more severe where the tooth fractures away pieces of it and you see granulation tissue over there. You might be left with a little bit of a nubbin left here where you see a little bit of tooth and granulation tissue over that. And the way to diagnose these is with your dental explorer. And you can do this while the animal's being spayed. Usually we don't see it in kittens or even like less than a year old cats, but once they get old, like 2, 3, 4 years old, you're going to start to see these very commonly. And you can also obviously diagnose them on an x-ray. They come in different stages. The first stage is where perhaps only a little bit of enamel is gone, or maybe enamel and dentin, and then enamel, dentin, and pulp involved. And once the pulp's involved, then it becomes painful. And then there's stage 4 where there may be a significant amount of bone loss. Maybe type A is where it's equal amount on the crown and the root. Type B is 4B is mostly crown, and type C is mostly root. And this is probably getting into it a little bit more deeply, but I think it's important for you to know in case you do have the capabilities of getting a dental x-ray unit, you'll be able to tell what type of treatment is best for these. So for example, with type 1, on an x-ray, you'll see the periodontal ligament around the tooth. The tooth root looks good. We'll surgically extract those. Whereas if it's a type 2 lesion, where the root is being eroded away by the resorptive lesion, you can just amputate the crown and intentionally leave the root in place, which is a simple, easy thing to do. But without the x-ray, you won't know which treatment to do. And then type 3 is where you have an intact root on part of the tooth and severe resorption on the other part of the tooth. And so you would do a surgical extraction on this root and amputate this crown. So here we have an example of type 1 where the roots are intact. You'll go ahead and surgically extract those. Here's an example of type 2 where you do crown amputation on the type 2 and a surgical extraction on the type 1. And then this would be an example of type 3 where you would do a crown amputation of one root and a surgical extraction of the other. And then we always like to recommend dental charts. It can be relatively simple or it can be quite elaborate. But you should keep track of what lesions are going on in those patients so that you're aware of either to actually tell the new owner that they have these problems, or ideally if it can be fixed before the animal's adopted. So we talked about periodontal disease being the most common disease that we see in dogs and cats today. So how do we treat it? Well, the most important thing is to keep the tooth clean. And we can do that by scaling the teeth and removing the calculus above the gingival margin. And this is most effectively done with an ultrasonic scaler and then polished, although you can use hand scalers if need be. So the power scalers are used with a light touch, adequate cooling, and moves quickly over the surface of the tooth. You have to also subgingivally scale, remove the calculus below the gingival margin in those deep pockets to remove calculus that's there. And this is how you go about doing that. And you just take that scaler or curette, place it underneath the, into the pocket and pull until the tooth root is nice and clean. And then polish when you're done. Okay, now I'm going to spend just a little bit of time talking about the structure of the teeth in dogs and cats, because it's important to know how many roots there are in each tooth. So in case you cut to the point where the extraction is necessary, you'll know how many roots are in each tooth. What I can tell you is here you can see down at the bottom and at the top, all the incisors and the canines have one root. On the bottom, the first cheek tooth has one root and the last one has one, and everything in between has two. On the top, the same thing, all the incisors and the first premolar have one. Then we have two teeth with two roots and three teeth with three roots. In a cat, everything in the front has one root. On the bottom, everything has two roots. And on the top, we have one with one, one with two, one with three, and this tiny little M1 has two little roots. Okay, I'm going to very quickly go through extractions because, again, that's something that if you have an infected tooth, it's hard to get that dog adopted without removing that diseased tooth. So a simple extraction, just elevate and extract a multi-rooted tooth root. You'd have to section it, and a complicated surgical extraction where you perhaps have a fourth premolar that needs to be, a flap needs to be made. And we're going to talk about that. And I will talk about how perhaps you can get resources to be able to do that. So I'm going to talk a little bit about, and then in cats, we could either do a simple extraction, a multi-rooted extraction, a single surgical extraction, and treatment for stomatitis and crown amputations. So to remove a single, simple, one-rooted, short tooth or one that's loose, just get your elevator in there, elevate around the tooth till it becomes loose. You take your forceps on there, turn it, and pull. On multi-rooted teeth, what we're going to do is we're going to section them. And there are different ways to section a tooth. You can use a high-speed handpiece, which is maybe beyond the means of a shelter practice, but there are ways to get that type of equipment in them, or they can share amongst shelters, or a electric motor pack, and that's relatively affordable, and that will suffice to section teeth. And so this is how I like to section the teeth. Rather than going, I used to always go right down the middle and section it one from the back from the front, but if you take a little wedge out, it gives you better access to getting those roots out. And when you're sectioning the upper fourth premolar and the M1, this is how, because they have 3 roots, you're going to have to section it twice so that you're dividing it into 3 segments, and you can take one out at a time. And I would say of all the teeth that you might have to extract, that fourth premolar might be the most commonly extracted tooth because of the way it's located. It's subject to getting fractures. Speaking about fractures, one of the most common causes of fractures in dogs' teeth are hard chew toys. And so that would be something that when you're adopting out these pets, recommend not giving the dog anything that's harder than what you cannot indent with your fingernail. So, for example, bully sticks, big no-no. Some of the, like the antlers, anything that's very hard, veterinary dentists calls that it's good for our practice because so many teeth break with that. So try to avoid those hard chew toys. Now when you're looking at a cat, this is how we would go about sectioning cat's teeth. We'll find a furcation, take our burr, remove a little bit of bone, section the tooth like that, and remove each root independently. Now with the surgical extraction, there's quite a few steps in that, and this is only on that occasion where you see an abscess tooth and the tooth has to come out. And sometimes they have so much disease around them, you could just pull them out without a lot of involvement, but sometimes there's still a lot of attachment left, and you may have to make a flap. So this is how we make our flap. We expose the buccal bone or the cheek side of the bone, drill away some of that bone there again, section the tooth, and then you'll take that elevator in between those 2 teeth and rotate and hold it, and the 2 roots or 2 segments should move in opposite directions. Again, then you could remove a little bit more bone over each root. Take your burr and remove the back side of the crown, the front side of the crown, and then elevate, and then extract. And the big thing is that you make sure you got the whole root. You want to look at the bottom of that tooth and make sure it's nice and smooth and round all around. If it's kind of sharp edges and you look into it and you see a little hole inside the root, that means that you probably broke off the root, and then you have to go digging for it, especially if it's an infected root. And so now we'll flush the area out well, remove any debris that's in there, and then release the periosteal layer of the flap, and then suture it closed. Fourth premolar, very common tooth to require extraction because of the infection that's associated with that tooth. So you just section it in 3 pieces like you see here, and then extract each root independently. Okay, so now regarding options for improving dental care in shelter pets, I know that you're so busy doing everything that you're already doing that it becomes difficult to find more time to provide state-of-the-art dental care. But there are some basic things that you can do, and the first thing would be is a good oral exam. And so you start with a very good oral exam, see if there's any periodontal pockets, any loose teeth, any tumors, any mandibular swelling. Sometimes they'll come in with exophthalmos, with the eyes exposed, nasal discharge. And then once you figure out that this animal definitely has a major dental problem, what can we do in a shelter setting to relieve that? Well, one of the things that we did at the University of Illinois is partner with veterinary schools, if you happen to have a veterinary school nearby. Now, sometimes it might be difficult to make that connection. You might not have a veterinary school, or they're understaffed and they don't have enough people to go around to go out and to visit the shelters. But it's always worth a try contacting them to see, or contacting local veterinarians in the area that like doing dentistry and are willing to perhaps donate some of their time to help treat some of these animals that would benefit from a good dental procedure. The other thing that might be very helpful is to look into possible CE labs for shelter personnel. I just got an email from our group. It's called the Veterinary Foundation for Veterinary Dentistry, and they have a program. It's called Make Me Smile program, and at least once a year they actually are able to get industry to donate a dental x-ray unit and a high-speed dental unit to shelters that are needing those. So there's a grants that can be written to write those shelters. They just recently donated that high-speed unit and a dental x-ray unit to the Chicago Anti-Cruelty Society. A board-certified dentist arranged to have them trained on that equipment. They donated their time to do a whole day seminar on how to use that equipment. So there are resources out there that can be utilized to bring dentistry into the shelter environment. And so various grants can help with that, and then other donations. So I have a few minutes left now for any questions. Anybody have any questions about any dental problems or how to bring? Yes?
Do you prefer hand scaling versus the ultrasonic scaling, or how do you feel?
Okay, so the question was, how do I feel about ultrasonic scaling versus hand scaling? I personally love the ultrasonic scaling. It's, have you experienced that, or? Yeah. The ultrasonic scaler is much more efficient, and you could probably do 10 ultrasonic scalings while you're still hand scaling that first patient. So it keeps anesthesia time down, and probably some of you are aware of non-anesthesia free dentistry. Well, it's really not, we call it cosmetic dentistry, because all you're doing while the animal's awake is trying to remove the calculus that's on the crown of the tooth. But in reality, the leading edge of the disease is actually underneath the gum line. And I can tell you the best dogs in the world are not going to let you subgingivally scale, because if you've ever had your teeth, well, I'm sure you've had your teeth cleaned, and it's not that pleasant, you know, especially as you get older and you develop some periodontal disease. So ultrasonic scaling is much more efficient, but you have to use it properly. You have to use it with a light touch, plenty of water spray, and if it's on the tooth for more than 5 seconds and the calculus is still there, move to a different tooth and come back to it so that you don't overheat the tooth. And the other thing that's important is that when you're doing your scaling, after you're finished scaling, you should polish the tooth, and that will help remove any etchings that you've created with the ultrasonic scaling. Anybody else have any other questions? Yes?
Do you prefer surgical extraction or
Okay, if I understood correctly, you were asking a question about the flaps. Okay, so the question was, do I prefer making flaps for all teeth or just certain ones? And I definitely prefer not to make a flap if I can, because number one, you're saving time. You're not opening up tissues where it's not necessary, and then you have to close them. So mainly my flaps are for canine teeth that still have a lot of attachment left, or say, for example, the carnasal teeth, the upper fourth premolar and the lower M1, where there's still a lot of attachment. Now, that dog that we saw with the severe periodontitis, and I showed you the x-ray where there's no bony attachment, I definitely would not make any flaps on that dog. I would just very gently go in there with an elevator and remove the tooth. And I probably wouldn't do a lot of suturing or anything, unless it was a larger hole, because by the time you see a patient like that, the tooth is so super erupted and this granulation tissue around it, all you have to do is remove the tooth and that dog will heal over nicely very quickly with nothing. So it makes the job easier when they're that severe, and you don't have to make a lot of flaps. So I definitely only make a flap if I feel that it's going to help me extract that tooth. Yes?
We see a lot of dogs at our shelter that are like young, maybe only like 1-2 years old during their spay or neuter, and they have just a real light coating of tartar or maybe just plaque. It's still kind of dummy. If you hand scale that, do you think that that is kind of creating more of an issue because you're scaling off the plaque, but you are not polishing, so you're leaving that rough surface? Would
Yes.
you suggest leaving that?
Yes. Okay, so the question was, if you see maybe a younger dog come in with soft plaque and a little bit of tartar, is hand scaling a bad thing for that? I think what they say is that if you hand scale or even scale with an ultrasonic scaler and you don't polish, the calculus will more likely come back more quickly. And the reason for that is that you've now etched the surface of that tooth, and that the calculus is going to attach to that tooth a lot quicker. And I've had that happen where people say, well, they cleaned up my dog's teeth and now the calculus is coming back faster. And so that's why it's kind of important to do the polishing after the scaling.
So would you say that if there's not time for that, to hand scale and then follow it with a polishing, because that would require us, if we're going to hand scale it, they're going to be just on the regular surgery table. We grab our hand scaler, scale it off, and then they go to recover. So that would require us to go for a second step, then to put them on the dental machine when we also have a technician doing extraction dentals at the same time. Would you still think that step is required, or would you just say skip the hand scaling altogether if you can't polish?
So you're talking about the animals anesthetized?
Yes.
Okay, all right, so, and your concern is that, okay, so the question was, say you have two animals down at the same time and one's having
We
this.
have 2 surgery tables running for spay and neuter, and then we also have a dental machine going for like extraction type dental.
Okay, okay. Okay, so you're down one polisher. So in other words, they have two machines, one machine, two tables, and if you're cleaning on one table with hand scaling and somebody else is using the machine on the other table, what do? Okay, I can tell you what you can do. You can get for about $35, you can get a little hand polisher that you plug in, and it'll do as good, it probably almost as good as the same job, and you just polish with that little hand operated scaler. It's a Profi cup that's very inexpensive, and so that and it doesn't take that long to polish, but you don't have to tie up your big unit, and so it'd be better to quickly polish than not polish at all. Okay. Yes. Could you speak a little louder? Yes.
Do you recommend cleaning the teeth before the extractions? We have a veterinarian that does all the
Okay.
extractions, and he always wants to
Okay.
clean all the teeth.
Okay, so the question was, do you recommend cleaning the teeth before you do extractions? Okay, well, what I like to do, what I like to recommend is doing your oral exam first and seeing what needs to be done. And then focus on the most important thing. So for example, if you have an abscess tooth, I would take out that tooth first and then leave the cleaning for later in case you start to have anesthetic problems and you have to stop. You've done the most important thing first. When I first was training in veterinary dentistry with a human dentist, he wanted to clean everything before we extracted. And then we ended up extracting some of these teeth. And I understand the reason for that, because now you're not driving calculus into the extraction site. But, you know, time is very precious when the animal's under anesthesia. So if you had the dog that I showed you with the really severe periodontal disease, I would just extract the teeth. I wouldn't be even worrying about cleaning them. But if, so I would say if I were having to prioritize, I would remove the teeth first and then go about cleaning. But, you know, somebody could give you an argument that, well, you should clean the mouth first because that's what the human dentists want. But it didn't seem right to me to spend all that time cleaning when you're going to extract them.
I've heard some different opinions from vets about the use of antibiotics pre-dental. If you could weigh in on that.
Okay, that's a very good question. So the question is, could I weigh in on whether to use antibiotics before dental? And that's still a little, you know, controversial in what should you do. And I think old school, and I was kind of old school, I kind of like doing that to help prevent the bacteremia that might occur. But it's in a healthy animal that you do get a bacteremia whenever you're scaling teeth and doing that, but it's self-clearing in a healthy animal. So what I think most people are now doing is, unless you have a immunocompromised patient, say with a heart murmur, kidney disease, liver disease, chemotherapy patient, I don't think it's necessary. Now, if you are presented with a dog with an abscess tooth, then I think it's wise probably to do perioperative antibiotics, but not routinely on cleanings, or even like say a fractured tooth that's not infected that recently got fractured. I don't think that antibiotics are necessary, but I do recommend antibiotics on animals with an abscess tooth. Yes?
How effective would you say full mouth extractions are in cats with stomatitis, and does age play a role in that?
What was the last part of that question?
Does age play a role in how successful that
Okay. Okay, so the question was, how successful is full mouth extractions on cats with stomatitis, and is there an age limit, or how does age affect that? Okay, so stomatitis is a major problem in our patients. Fortunately, we don't see it that often, but when I was in practice at the University of Illinois, we had a specialty clinic, and we probably would see one a week. And probably you see more in a shelter than you might in general practice, because you're getting relinquished animals and animals that are out on stray, and they may be more prone to getting that. So what my thought is if it's a very severe case of stomatitis, you know, where it's affecting the whole dental arcade and maybe even the pharyngeal arches, full mouth extraction in 80% of the cases will resolve or greatly improve that patient. 20% of the cases will need continued medication, and the medication for stomatitis is cyclosporin, and some people add metronidazole to that. And then there's maybe 5% that even in spite of medication, they're not going to respond to treatment. And so, and some people, if it's not too severe, will try to treat them medically with scalings and keep the mouth very clean. But then we have on the other flip side, if you have a severe pharyngeal inflammation, then no matter, treatment is very difficult and the prognosis is more poor. And then you also, obviously, if you have an FIV positive or FELV positive cat, that could make it more difficult to treat. But very rarely, like I could say probably less than 5% of the cats with stomatitis are positive for one of those viruses. Yes?
In stomatitis, do you recommend leaving the canine teeth?
Okay, so that's another good question. So the question was, in stomatitis, do I recommend leaving the canine teeth? And what I do with my stomatitis cases is that I usually remove all the teeth where the inflammation is severe. So if you have severe inflammation around the canine teeth, then I'll take those out. If the inflammation is limited to the cheek teeth, then I'll just take those out. Sometimes the incisors are severely involved, but the canines are okay, so they'll take those out and the cheek teeth. But sometimes what happens is you take just the cheek teeth out, and then it progresses and it gets severe around the canine. So some veterinary dentists are recommending full mouth extraction, but that adds more to the anesthesia time and the recovery time. So I usually, if it's not severe around the canines, I'll just remove the premolars and molars. Okay, so I think that's all I have time for questions. Thank you so much.